welcome to Imagine Talks 2021, Vivo, Miss Asian America 2020. Welcome to San Francisco, California. Can you, before I even jump into some of the questions I have for you, can you tell us a bit about yourself, where you're from, a little bit of your journey, and what you do today?
Yeah, of course. It's really great to finally meet you in person.
Likewise.
So my name is Vivo. I am Vietnamese. I was actually born in Vietnam. So I lived there for 9 years and then I moved to the United States. Lived in Anaheim for a few years. Then my family found a job opportunity in Florida. So we moved over there and I stayed there for 10 years. And after finishing PA school there, I actually moved to Arizona. So right now I'm currently living in Arizona, working as a physician assistant.
Wow, so from Vietnam, Anaheim, Florida, and then Arizona.
Yes.
Wow,
So all
okay,
over the place.
wow. What is your favorite place in the world you visited and lived, and why?
I would say Vietnam, honestly. I think it was such a great childhood memory for me, just being there, being with my big family. We have a large family in Vietnam on my mom's side. And every time I think about that memory, I think it's so innocent and such a great youthful like childhood. So if
Mm,
I could go back, I would stay there for a few months and just enjoy myself there.
fantastic, fantastic. Okay, so now you also mentioned to us that you are a physician assistant.
Yes.
So 2020 must have been one heck of a year for you.
Yes.
All right, tell us, if you don't mind, what was it like being a physician assistant in 2020 during one of the most historically crazy, just pandemic-ridden places?
Definitely. I think I've only been a PA for 2 years and going through PA school, we were not trained for this, right? We were not prepared or equipped to deal with the pandemic. I started my job as an urgent care physician assistant, PA
Hmm.
in Arizona. And at first, we saw regular complaints, heart attacks, UTIs, sprains, fractures, things like that. But when
Right.
the pandemic hit, that's when we had to completely change up our game. We went from seeing maybe 20, 30 patients a day to almost 40, 50 patients, with almost everyone with COVID complaints,
Hmm.
with symptoms that are COVID related. Definitely has been a game changer. We had to really focus on what's important, what symptoms to look for. Um, this year especially really exposed a lot of cracks in our healthcare system. I feel like with the lack of PPE, ventilators, hospital beds,
Right.
testing.
Right.
So there was a period of time, months, where we had to kind of pick and choose who gets a test, a COVID test. And I think that was really tough because we had to turn away patients
Hmm.
who didn't meet the qualifications to get a test.
Hmm.
And I think that was a really, really hard time for me mentally and physically.
Yeah.
Yeah.
So, as a first line uh, healthcare provider, what are one or two things that you really see as one of the biggest weaknesses for our current healthcare system in the nation right now that was so overtly exposed because of the pandemic?
Yeah, like I mentioned, I think our healthcare system is not equipped to deal with this pandemic. I think moving forward, we will hopefully be better prepared if we were to be hit again with another pandemic. As I mentioned, we need to really focus on allocating a separate funding
Hmm.
towards
Right.
research, for instance, so that we can be prepared for the vaccine. And then also, we need to invest in more ventilators, have more hospital beds available just in case another pandemic hits, because hospitals has to turn away patients. I've heard hospitals having to turn away patients who got into car accidents just because they don't have any beds available at the ER or even in the ICU.
What about, I've heard some talk about a better national coordinated effort where
Mm-hmm.
there's almost like a federal level of a control system where you can actually have a more standardized communication system amongst hospital systems in
Mm-hmm.
different states so that much quicker, much more efficiently, data and coordination can be done in a national scale,
Mm-hmm.
almost at the same level as the military can do right now.
For that, I can see the pros of that just because some hospitals may not use the ventilators and they
Mm-hmm.
can go through that communication and get the appropriate technology or equipment.
Mm-hmm.
So that's the pros that I see in it. In terms of like the cons, I think it's just really hard to get all the hospitals to work together to come up with such a joint system,
Right.
with everything, with private hospitals, with public hospitals. I think it's just a challenge in general to have that. But
Okay.
I definitely see that. I think it's beneficial moving forward to have that available.
Great. And also, as we're talking about changes in healthcare, what are your thoughts about the evolution and the more accessibility of telemedicine and technologies like that?
I think after being exposed to the pandemic and COVID, we utilized telemedicine a lot more. My clinic specifically,
Mm-hmm.
we use telemedicine for all patients with COVID symptoms. So they would come in, they would call us first. We would bring out the paperwork to the car, and they would call me on my the audio video chat
Mm-hmm.
telemedicine that we used. And I would do a video chat with them and talk about their symptoms.
Mm-hmm.
I'll have my staff go out, swab them, we'll test them, and then we'll let them go, discharge them.
Mm-hmm.
It's just a more efficient way to deal with this because if we bring everyone into the clinic, we're exposing patients with COVID symptoms with patients who are there for regular complaints, like a sprain or like a fracture
Mm-hmm.
or UTI. So I think it's a very efficient way. Definitely change our method moving forward. I think we're going to be utilizing telemedicine a lot more. Even after the pandemic is over, it's just more convenient for patients to be accessing this at home. Plus, they don't have to miss their appointments to their doctors because it's just so easy. Patients without transportations, like elderly patients, can even access telemedicine and get help that way.
Do you see that as a general trend that most providers are now much more accepting of telemedicine? As I think pre-COVID, there was probably a lot of pushback, right?
Yes.
But do you think after, and I won't want to say after COVID, but as we begin to coexist with COVID, this becomes much more of an acceptable application and alternative now for providers?
Absolutely, absolutely. I think personally, I can speak on that. I was really against telemedicine because let's say someone comes in with the ear complaint. I have ear pain for 2 days.
Yeah.
How are you supposed to look into their ear via telemedicine, right?
Right.
But right now, utilizing it for the first time after being hit with the pandemic, I can see the pros. I think all the pros outweigh the cons,
Okay.
honestly. So I think being forced to use telemedicine during this period of time has really opened a lot of people's minds
Okay.
to utilizing it in the future.
Okay. All right. So in addition to digital technologies, we're also looking at new biotechnologies. And in this case, of course, it's a vaccination, right? The vaccine. Now, if I'm not mistaken, you've already had your first shot out of the two, right?
Yes, I did. I have my first Pfizer dose.
And I know the first rollout's going to be for frontline healthcare providers and workers, right?
Correct.
So what has been your personal experience as you taking your first dose of vaccine? And also, what is the message you want to try to tell everyone out there about the vaccine as we start rolling it out in April, June, July, into the more general public out there?
Right now, since the vaccine is just so new,
Yeah.
I know a lot of people have questions in regards to effectiveness. What are the side effects? What should I look for? Should I be scared to inject something like this? Usually vaccine takes years to develop, 3 to 5 years.
Yeah.
This one took us months.
Yep.
Right? Within a year, we have the vaccine already. So how can we trust this? I get questions like that all the time from patients. I had my first Pfizer dose. Right now, the two that are available are Moderna and Pfizer. So both are about 95% effective. And the first dose, usually you would have mild symptoms. Personally, I experienced just mild soreness and fatigue on the injection site, but that's completely normal. Even with the flu shot, with any injections, you will experience some type of soreness there. So I had that, and besides that, I didn't have many other side effects that are listed, but some common ones include maybe fever, chills, you feel kind of tired, maybe some diarrhea, GI symptoms, but I didn't have any of that. So I'm still waiting for my second dose, which is sometimes next week.
Okay.
So it's 3 weeks apart. the
Mhm.
first and the second dose. So supposedly the second dose, you're going to have more side effects because by then your body has already built antibodies against this virus. So with the second dose, you're going to have more symptoms.
Right.
Yeah.
So now, obviously, America is a huge country, both in landmass, but especially in its population as well. And we're hoping, absolutely, to get as many people vaccinated that are open to it between now and say 2022. What percentage of the country needs to be vaccinated and protected for us to begin to even achieve this whole concept of herd immunity now?
You know what, Francis, that's really hard to say, but personally, I believe that at least 60 to 70%
Okay.
for us to get herd immunity. But it's hard because there are a lot of anti-vaxxers out there.
Mhm.
There's a lot of people who, like I mentioned earlier, don't know about this vaccine. They don't know if they can trust it.
Right.
I've read a lot of articles out there, surveys that
Mhm.
people, even when it's available
Mhm.
in April and May, they may not take it. And that's going to be a huge issue
Mhm.
to obtain herd immunity. I feel like a majority of people, like 60 to 70%, should have it. But it's hard to kind of convince people who believed that vaccines don't work. It's hard to kind of relay that information to them.
What do you think is the best way for us to educate? Is it through multimedia? Is it through direct consultation with the provider? What's the best way, do you believe it is, for us to educate the public for them to make their best own decisions on this vaccine? Because that is a very critical step for us to begin having some new normalcy of life again.
I think the best way to really educate others is by being an example. So right now, the frontline workers are getting the injection first. So I'm utilizing my social media to get the information out there. I have a medical page, Vivo_PA.
Very cool.
And I go on there and I talk about the vaccine and what I think about it. And I think just showing them that we believe in science and we are willing to do this and take this step is saying a lot and showing example. I think that would gain a lot of their trust more. So I think a lot of healthcare workers or people in politics, political leaders, influential people should really step up and talk about how they trust science and the vaccine and how everyone else should too. And I think that's going to really help.
Fantastic. During this time when you're going through the taking care of all of these patients coming through, was there a certain demographic or population that you saw that was being hit the hardest and had to really figure out, and you helped them figure out how they're going to get through this? Like, what population demographic did you see that was the most hurt by this year?
Yeah, great question. I think the biggest demographic that was hit was the low income social economic class. It's sad to say, but people who can't afford medicine, can't afford to be seen regularly, who struggle with chronic conditions like diabetes and asthma, have really struggled with COVID. Once they get COVID, it hits them a lot harder compared to someone who is able to afford healthcare. They're able to see their doctors or provider regularly and get blood work and the medications that's needed. So people who can't afford, like low income, uninsured, underserved population, were the one that hit the most. And that's why my mission is to provide care and more access to healthcare for those population. So the clinic that I work in now actually geared towards helping patients without insurance. So we provide free testing for them. Also, sometimes they come in and we'll test them for COVID and they're negative. I still prescribe them medications just in case they have like pneumonia or other conditions, and they don't get charged for the visit at all.
What is some of your volunteer work you do for these underserved populations? My understanding is that you actually go and work on some of these volunteer programs for people who are in these really hard-hit, low-income immigration families. What is some of the work you do on the side in addition to your regular day job?
So some of the volunteer work I participated in was working with an organization called Shepherd's Hope. So they dedicate their time an effort in helping uninsured and underserved populations get just access to healthcare.
Mhm.
And I think in America, to say that a developed country, um, I think getting healthcare should be just a right.
Mhm.
You know, it shouldn't be something that if you don't have money, you can't get access to healthcare.
Right.
And the reason why it's so important to me is because I grew up not having access to healthcare. My mother was, when we first came here, was
Right.
diagnosed with a condition where she needed surgery and she
Mhm.
needed long-term treatment, and
Mhm.
she couldn't get access to healthcare because we couldn't afford it. So I think that was what really motivated me and drove me into wanting to go into medicine and choosing this mission of helping people get more access to healthcare, people who can't afford it.
Mhm.
And I volunteer with Shepherd's Hope for quite some time now.
Mhm.
Now I'm working as a PA at an area, like I mentioned, underserved, and helping people get more access to healthcare.
Mhm.
But my plan for this year is to continue to do that and hopefully have my own nonprofit organization geared towards helping get more access.
What do you think we can do as a nation, um, on a national and maybe even federal level to make sure that less of these people have to fall through the cracks?
I think the government should really focus on allocating more funding
Okay.
towards not only research but healthcare in general. I think just having programs available for people who, or for even free clinics available for people who can't afford it,
Mhm.
would really help, because if you provide these care for these patients and they come regularly to see you
Mhm.
and they get their chronic conditions like diabetes or asthma taken care of, then you wouldn't have to deal with them ending in the hospital, because that would cost a lot more to treat them when they end up in the hospital.
Right.
So I think long term, it's something that we definitely need to consider, just focusing on preventative medicine, so that we don't have to see these patients suffer in the hospital.
Right. We only have a few minutes left in the interview here. What are some last words of wisdom that you want to give as a provider and also as one of the community leaders in this mission to the audience as we go forward into 2022 to 21 and 22 as we learn how to coexist in our new COVID world, to really help us achieve that herd immunity and that that new level of independence again, so we can actually go out to start living our lives again.
I think there's a hope. There's hope now with the vaccine available, but definitely we still need to continue to isolate. We need to wear our masks
Mhm.
and stay safe,
Mhm.
wash your hands often, try to not stay in a crowded place.
Mhm.
I think continuing to do that will really help push forward, push us back to quote unquote the normal, right? So I think that's my biggest advice. Even with the availability of vaccines, we still need to continue to stay safe and
Mhm.
wear your mask and social distance.
Okay. Well, thank you so much. Always wonderful to see you. This is my first time seeing you in person, and we can't wait to see you again in 2022. Hopefully in
Yes.
a much more public venue. But always thank you for all your great work and all of your examples, and of course, congratulations on your Miss Asian America 2020 title.
Thank you so much, Francis. I
Thank
had a
you.
great time. Yeah.
Bye bye.